In the beginning, we have learned there are three approaches as far as the drugs are concerned for the treatment of type 2 diabetes, uh, and that is insulin secretagogue, insulin sensitizer, and third one is digestion hampers. So now we will talk about digestion hampers, that is those drugs which will going to inhibit one of the enzyme present in intestine, that is alpha glucosidase enzyme. Two drugs we are going to learn from this class, that is acarbose and voglibose. Now name itself is explanatory over here also. Acarbose means that is a drug having not going to allow carbohydrate, that is acarbose. These two drugs act as a competitive inhibitor for alpha glucosidase enzyme, and I already told you in the beginning video when we were talking about the classification of a drug that this enzyme is present particularly in the intestine, that is brush border of the small intestine, and role of this enzyme is to produce breakdown of larger carbohydrate into smaller one, that is it will convert carbohydrate into monomer so that it will become absorbed into the blood. And inhibition of this enzyme allows less dietary carbohydrate to be available for the absorption, and in turn it will reduce the blood glucose level into the blood. Because these do not enhance the insulin secretion, and when these used as a monotherapy, means only one kind of a drug, no other drugs will be prescribed in addition to this, hypoglycemia is not generally concerned with this agent, which is the case of other agent. Acarbose and voglibose, these agent become binds to alpha glucosidase, and alpha glucosidase enzyme remain busy in complex form with these two drugs, and whatever carbohydrate we have been consumed from the food, it remains intact without being broken down, and as a result of that monosaccharides are not available into the stomach, and therefore their absorption into blood become reduced. We will discuss about a first naturally occurring oligosaccharide drug, that is acarbose. Its structure is there in front of you. You can see polymeric structure, and I already made mention it's a naturally occurring oligosaccharide which is obtained from the microorganism, that is Actinoplanes uthensis. This acarbose, being a polysaccharide enzyme, alpha glucosidase attempt to hydrolyze it preferentially. Means we before alpha glucosidase hydrolyze carbohydrate from the food, these drugs become preferentially hydrolyzed so that enzyme become busy in hydrolyzing it, and carbohydrate remain intact into the stomach. It acts as a competitive inhibitor at alpha glucosidase, which in turn reduce the intestinal absorption of starch, dextrin, and disaccharides. It is evident from the structure of acarbose that it has got similarity in the structure with carbohydrate, and therefore enzyme is not able to recognize whether it is carbohydrate from the food or whether it is drug, and therefore it preferentially binds with the acarbose. Another drug from this class, that is voglibose, structurally when we compare with acarbose, it is very simple in the structure. You can observe nitrogen over here. This nitrogen has been introduced intentionally by the method of isosteric replacement, that is iso means same, structure or moiety having similar biological activity and similar steric property. So oxygen has been replaced by nitrogen to make the compound, make the drug analogous with the sugar, and again uh, this feature allows recognition by the alpha glucosidase as a substrate. So alpha glucosidase get binds with it, and carbohydrate remain unhydrolyzed. This results in again competitive inhibition of enzyme and delays the complex carbohydrate absorption from the gastrointestinal tract.